Now the government will purchase Johnson & Johnson vaccine in an effort to vaccinate Kenyans following the global shortage of AstraZeneca vaccine. Meanwhile, the Ministry of Health has declined the private health sector's offer of distributing about 70,000 remaining doses of Sputnik vaccine due to vaccine shortage in the country. This even as the shortage threatens to halt COVID-19 vaccination exercise locally and internationally. Our health reporter Zainab Mohammed begins our broadcast tonight.
The Sputnik V vaccine distributors are looking at a loss after the Ministry of Health declined their offer to distribute the remaining vaccines to Kenyans as a way of boosting the number of vaccinated persons amid vaccine shortage in the country. The ministry insists the importation and distribution of COVID-19 vaccines shall remain solely in the hands of the government.
We announced last week, during the 2 weeks ago, during the NAC meeting, that we will continue to service vaccines and service Kenyans for free vaccines without opening the private sector window because of the possibilities of, number one, confusion regarding how we are doing it in the country. Number two, accusations of our own people beginning to sell even what is free in our hospitals and elsewhere.
This even as COVID-19 vaccine shortage globally threatens to halt vaccination exercise locally and internationally. According to the Ministry of Health, the second batch delay of 1 month may just be more.
The African continent is supposed to have received by now some 75 million doses from India. We have only received some 12 million doses out of an expected 75 million doses. So what that tells you that the flow of the vaccines is going to continue to be challenging. Worse still is that there are some countries under the COVAX facility with about 93 countries, there are some countries that have not even begun vaccinating their people, because no deliveries have been made even for the first dose.
The ministry further says, in a bid to counter the challenge, Kenya, through the African Union facility, intends to import 1 million doses each of Pfizer and Johnson & Johnson vaccine. However, the ministry has not clarified when the vaccines are expected in the country, as a negative 70-degree storage requirement of the Pfizer vaccine poses a new challenge to the country.
We recognize that because the Pfizer vaccines are supposed to be stored at minus 70 degrees. And what we are doing is that at the same time as we are acquiring the vaccines, we are also acquiring the fridges, the special fridges that we are supposed to use.
So far, a total of 750,000 people have been vaccinated. Zainab Mohammed, TV47.
Still on